Good morning, Charles Cockerton here, President of the British Benevolent Society. I hope I find all of you as well as can be today, and welcome to the BBS podcast. Today we have a very relevant discussion for you around health and coronavirus. This is particularly important now that the world is starting to go back and reopen after the lockdown. And we have a really special guest, Professor Warburton in Los Angeles, a fellow Brit and a doctor, who I'll be introducing to you in a moment. First, just to restate the mission of the British Benevolent Society as a charity. The British Benevolent Society is a charity with a core mission to provide aid and relief to British citizens in need. Since the coronavirus lockdown, we've distributed $50,000 to Brits who have been directly affected by the virus out here on the West Coast. However, we also wish to provide the British community with practical advice and information during the pandemic. And today we have a great opportunity to speak with David Warburton about medical issues and health-related concerns around the virus. I'd like to thank all of our members for the questions that have been submitted, and Jen, our Executive Director, also on the call, and Arif Damji, fellow board member, for collecting the information. And with that, I'd very much like to welcome David, Professor Warburton, to the podcast. Professor Warburton, please could you introduce yourself?
Well, thank you. It's very nice to be here with the BBS. And I'm David Warburton. I'm, as you can tell from the way I speak, I'm British. I've been out in Los Angeles for about 40 years. I work at the Children's Hospital of Los Angeles and also at University of Southern California. My original training was in London at St. Thomas's Hospital. As you probably know, Boris Johnson's life was saved recently at St. Thomas's Hospital, so we're quite proud of that. And I'm very happy to answer your questions about COVID and what we should be doing.
Well, thank you very much. So let's start with what is COVID-19?
Well, COVID is a coronavirus, and back at St. Thomas's about almost 50 years ago now, it was discovered by a Scottish faculty member. And I remember she showed us pictures of this virus as students. And she said, look, it's just like a Scottish crown. So it's a round structure on electron microscopy, and it has these little spikes on it that look like the jewels in a crown. That's why it has the name. It's the same class as virus that causes the common cold. So it is actually quite infectious, just like a common cold. But this particular version, the COVID-19, it's a mutant, and it has some more virulent features. So it's a nastier virus than the common cold, and if you get it, it will make you quite ill. And so it depends on how old you are and whether you've got other conditions like diabetes, hypertension. These things are risk factors. On the other hand, there are some people who are younger who may carry it without feeling unwell and spread it. So it's a very difficult public health problem. Really, all we've got at the moment is social distancing and hand washing and cleaning surfaces and things like that. And these measures have worked. They've knocked the number of cases down in Britain, and in some parts of the world it's knocked it all the way down, like in New Zealand and Mongolia. The challenge we have now is what happens with economically when everybody's on lockdown. How do we undo that without getting too many people sick? And that's the challenge we have. So it's really important that we do our social distancing and we wear a mask in public and we wash our hands so that we don't transmit the virus from one to another.
Thank you very much for that overview of exactly what the coronavirus is. And just stepping back, where did it originally come from, and how is it different from other viruses such as SARS and MERS, for example?
Yeah, well, this particular virus was first discovered in China, in Wuhan. And the Chinese actually did a very good job of identifying the virus and sequencing it and putting that information out in the public domain. They also did a pretty good job of locking down Wuhan and knocking down the epidemic in China. But of course it got out, and it started, because it's highly infectious, it got out and started being transmitted around the world. Mongolia did a lockdown very early, and they have had no transmission and no deaths from the virus. So they're right next to China. But in Britain and America, we were a bit slower off. We were a bit slower off the dime, and our governmental structures are different. There's much more freedom in our country. So, if you consult the New Hampshire license plate, it's live free or die, right? So people in America and Britain don't like being told what to do. And so there's been a lot of pushback on the public health precautions.
Thank you. And talking about the virus itself, so what are the typical symptoms, and how dangerous is this disease, and how do you contract it?
So the virus is spread mostly by droplets, similar to a cold. If you sneeze in a room full of people, a lot of people catch the cold. If you kiss somebody and that you get droplets in their eyes, what have you, that is how it's spread. Now, to begin with, it feels a bit like a bad cold. You have headache and you have malaise, you don't feel well, you run a temperature. And then some people think they're getting over it after about a week, and then suddenly they get a whole lot worse. And it then can become pneumonia. And you can end up with a very severe inflammation of the lung, and it can spread to other parts of the body, the liver, the kidney, the brain, etc. And in some cases, it's fatal. And this is due to multi-organ failure, particularly lung failure. So in the first instance, if you think you might have it, the important thing is to isolate so you don't give it to somebody else. And then if you feel you're getting worse, you rest, obviously, but if you think you're getting a lot worse, you should call your doctor, call your hospital, and eventually maybe go to the emergency room if advised to do so, or call an ambulance if you can't drive. So it is nasty business if you get a bad dose of it.
And is the virus the same across the world, Professor Warburton?
Well, basically, yes. There are substrains of the virus that have appeared. There appear to be like about 8 different substrains of it. So that could explain why it's more virulent in one part of the world than another. And of course, this is an RNA virus. And so as it is copied in the cells of the body and distributed, there will be copying errors, because copying of RNA is not perfect. And so there have been mutant strains arising, but most of the mutations are in non-essential parts of the viral genome, so it doesn't actually change the proteins that the virus makes. But there's a capacity. The more it passages and the more it replicates, the more copying errors there will be.
Okay, yeah, thank you very much. And Jen, so to introduce our Executive Director of the British Benevolent Society, who many of you know well. Jen's been busy, as I said at the start, talking to our membership and canvassing questions. So Jen, if you could introduce yourself, and maybe you could start asking Professor Warburton some of the questions that our membership have kindly submitted.
Yeah, so thank you to all of our members who submitted some questions, and a lot of our questions that came from the membership are very, I would say, practical as we approach summer and try to remain vigilant, but also keep ourselves educated. So I think the first question is 6 feet really enough to be safe? safe? And if I wear a mask, am I protected if I'm 6 feet from someone?
Right. Okay, the first thing is wearing a mask. So you wear a mask to protect other people because this virus spreads by droplets. So you don't want to sneeze and sneeze on somebody else. Okay. Wearing a mask will reduce, depending on what kind of mask it is, will reduce the chance of you catching the virus. So if the droplet gets caught on the outside of the mask, you won't catch the virus. And of course, in laboratories, we wear N95 masks, which are the most, which are actually quite, they would exclude the virus completely, but they are quite nasty to breathe with because, you know, they're small holes. You've got to breathe through a lot of small holes. So wearing a mask is a good idea. Now, the distancing is interesting because it really depends on how far a droplet can travel. So 6 feet's probably okay unless somebody has a massive sneeze, right? And if you sneeze behind a mask, obviously, it's not going to go 6 feet. So in some parts of the world where people are very crowded together, like India, they're recommending 1 meter separation as opposed to 2 meters. 6 feet is 2 meters, right? So I think we're quite lucky in America to be able to do 6 foot separation. And personally, I feel quite comfortable being 6 feet away from somebody else, especially if I'm wearing a mask.
And I know a lot, well, I know now and I've heard of this, we wear masks to actually protect others from us, but a lot of us use cloth masks, hopefully that are, they're filtered or can keep things in or out. Can we reuse those masks? Should we be washing them?
Yeah, if you've got cloth masks, you probably should wash it at least once a day. We just have 2 or 3 of them, and one to wash, one to wear, just like your underwear. Your underwear multiple days, I don't think anymore. We used to in the 1950s, but I think these days you would wash your mask. The other thing you can do is leave it out in the sun, because being in the sun will fry the virus because of the ultraviolet radiation from the sun and the heat.
Interesting. Okay. So even, I mean, I myself, I've been social distancing, my family has. So I really only wear masks when I do essential things, like go to the grocery store.
Yeah. Yeah. So the other thing we didn't discuss is the issue about space and density. So you can think about the grocery stores. They're pretty big grocery stores. I mean, and it depends how many people they let in at once. So I know my local Trader Joe's, they don't let in too many people at once. So it's actually quite easy to maintain 6 feet of separation. It's a bit harder at Ralph's where they let more people in, and I don't know about Costco, how that's going, Walmart. But it's about the size of the space and the number of people. So if it's a small space with a lot of people, then the risk of transmission is high. If it's a huge space with few people, obviously it's lower, because it's all about how far can a droplet go and how many droplets will go up your nose, basically, or into your eyes. So actually wearing a mask and a pair of glasses are a good idea, especially wraparound sunglasses. Those are good.
Okay. Perfect. I mean, it seems very sensible, and thank you for the underwear reference.
The other thing is about handshakes, right? So the reason you don't shake somebody's hand is because you have been touching your face and they've been touching their face, and maybe they've sneezed on their hand, and that's why you don't do it.
Yeah. Okay. Well, now and I think everyone hopefully knows that, and I know it's really important. I think one of the reasons we're having this interview right now is things haven't changed, so we need to continue these practices. Yeah. But one of the things that has changed slightly is that some people are returning to the workplace, right. And for those that are, how can they keep safe? How can they keep
safe? It's the same thing, isn't it? I mean, basically, it's 6 feet of separation, wear your mask, wear your glasses, wash your hands. And in a workspace, probably clean the surfaces every so often, like once an hour or something. Everybody mop down their surfaces. Some shops are doing that. You'll hear you know Ralph's or somebody will come on and say it's the top of the hour. Everybody clean off your workspace.
Mhm.
And you'll notice that in shops now they have a plastic separation between you and the checker. So the checkers in grocery stores are essential workers, and they are exposed to a lot of people. I mean, they meet several hundred people a day on their shift, right?
Yeah.
So at the moment, we're sitting in our living rooms, so doing this conference, but we're not meeting anybody. So we're pretty safe at the moment. But when I go back to the hospital, I'm going to have to watch it, you know. And so we have at our hospital, we have temperature screening, we have history screening, asking people how they feel and so on. And then we insist that everybody wears a mask, washes their hands.
Thank you for all of that. Arif, I think I'm going to maybe hand off these next questions to you.
Perfect. Thank you, Jen. And for all those who don't know me, Arif Damji, board member of the BBS, and thank you everyone for taking the time to do this. Now, when we did go out to the membership, as you'd imagine, one area of concern were what we call discretionary tasks, right? We all know what's essential, but as we revert back to normal life, what is wise, what is advisable, what is not. And one big topic within that category is travel. We all have been restricting ourselves from travel. And as summer approaches, people are questioning what is advisable and what isn't. And so one area that we did have a number of questions on was accommodations. If I choose to travel, should I stay in an Airbnb? Should I stay in an RV? Should I stay in a hotel? Should I not be staying anywhere at all and staying at home? And love to get your perspective.
Well, if you think back to what we were talking about with the characteristics of the virus and how it spreads, probably discretionary travel is not a good idea at the moment. My wife recently traveled to join our daughter on the East Coast because she had a baby, and Granny wanted to go and help take care of the baby because daughter was going back to work. And I took her to the airport. We did our Lawrence of Arabia thing, you know, with the cloths and the masks and all of that. And she got there and then isolated for 2 weeks before being close to the baby and the daughter, and everybody's fine. But on the other hand, now the daughter's gone back to work, and she's an anaesthetist at a hospital, so that's a challenge. I personally, I wouldn't take the risk, especially as you know, there are many parts of the world where people aren't doing any precautions. My daughter practices in Georgia, and that's a very interesting place. Nobody is wearing masks there very much in the public. So I you know, it's up to you. I mean, you could end up having a holiday in heaven is the problem, right? And if you're willing to take that risk, well, more power to you. I mean, actually, I'm supposed to be in Italy at the moment. I'm on sabbatical, and I'm supposed to be living in a castle in Florence, doing stuff at the Children's Hospital there. And as you can tell, I'm here in LA because I didn't do that discretionary travel.
That's fair.
So that my personal advice is don't do it unless you're a real risk taker. And then the question is about where you would stay. The question is, where would the droplets go, right? Where can you find droplets? And so a hotel, well, they get cleaned. But I mean, do hotels really change the sheets? I don't know. Maybe you should take your own pillowcase or something. I don't know. It's an interesting question. If you've got essential travel because you've got to go, well, a lot of so-called essential travel is now done on Zoom, right? I mean, I've done tons of Zoom since this started, and I do stuff for various governments, and I've been on Zoom on 3 continents, you know, whereas normally I would get in the first class cabin and fly there. So I think at the moment it's just not worth the candle to go traveling.
That's fair. And for those that do decide to travel for essential or discretionary purposes, any advice additional to wearing a mask and keeping spacing on how they can keep that a safer experience, right? So if they're going to fly on a plane, stay at a hotel, anything else that they can do just to try and maximize?
Well, I think a lot of the airlines are trying very hard with the social distancing on the plane, and they're having their cleaning crews wipe everything down with disinfectant. But I still think you probably should bring your own wipes and wipe down your tray and your seat rests and all that. And if you go to the bathroom, I certainly would wipe that down. You know, wipe down the toilet seat and the base and things like that. And just stay out of droplet range.
Makes sense.
Wash your hands. Wash your hands. You know, use your personal disinfectant.
And for those that are traveling to see family, and we'll make the assumption here it's essential, we had a question from membership about visiting an elderly parent, for example, and they were asking if they should stay in isolation when they travel to a new state, let's say, before they go and meet family. Should they stay, so they take 2 weeks before they go and see them? What's best practice and what should they do?
Well, if you are infected, then you really should spend 2 weeks before you go and spend time with relatives, especially elderly relatives, because elderly relatives are at the highest risk of anybody. Because number one, they're old, and number two, they probably have two or three pre-existing conditions. I mean, we doctors say you have a disease for every decade of life after the age of 50. So, you know. So I think, I guess it depends. So operators of nursing homes are not allowing visitors because they know that once they get a case of COVID in that nursing home, they're going to have a massive die-off. So there are nursing homes that haven't had any and are very strict, and there are nursing homes that have allowed visitors and they've regretted it. So I think in terms of going to see elderly relatives, number one, I wouldn't do that. And number two, if you absolutely have to, you really need to isolate for 2 weeks before you go and see that person. So that's what my wife did. She flew out to Savannah. She stayed isolated in a room for 2 weeks until she was able to take care of the baby and her daughter. So.
Makes sense. That's very helpful. And thinking on the other end of the spectrum, for those parents who have young children, we know that the entire education system has been made virtual over the last few months. Yeah. But as schools start to reopen in some form of another over the next academic year, should they feel comfortable with their child going to school?
Well, on the whole, children tend not to get sick with this virus, at least it's not as much as adults. But we have had some cases of kids getting very sick and a few cases of kids dying. And there is a new syndrome caused by COVID, which is rather like Kawasaki's disease. It's an autoimmune disease that makes your fingers and toes go blue, and it affects your heart. And we've had some young children with that. So personally, I'm not sure I would be entirely comfortable, but hey, life has to go on. The kids have to get an education, and the best way to get educated is alongside other children with a competent professional teacher teaching you. That is the best way to get an education. So it's a balance, and I think the best thing you can do is teach your kids to wash their hands and do the social distancing and wear their gloves and their mask or what have you.
Makes sense. And where do you think summer camps appear on that balance, right? Coming up in a few weeks for some.
Yeah, well, I wouldn't do that. This year we've cancelled we used to have a lot of summer camps for cancer kids and asthma kids and this kind of stuff, and all that's gone out. And of course, in the summer, I used to go to science camp. I mean, I used to go to a thing called a Gordon conference where we stay in some dormitory somewhere at some ghastly prep school and spend the entire day listening to science presentations, and all that's gone. We're not doing that this year. None of those meetings are happening. So I wouldn't do summer camp where you're going to be around a lot of other people.
That's very helpful. And so if we take a step back and think about normal life, food preparation, consumption is obviously critical. And so there are many out there who have questions, firstly about having food delivered from restaurants and whether that's safe. And then the next kind of variation of that question, as restaurants reopen, is it safe to go and eat inside of a restaurant or on their patio?
Well, I think food deliveries, if the food's been cooked and the delivery guy doesn't have COVID, and the chef didn't have it, you're probably okay. And I guess you don't know. So to some extent, you have to take that on faith that the proprietor of the restaurant doesn't want to infect you. So I know I see a lot of people waiting for deliveries at my local fast food joints. So I think you got to be careful. It's the same thing when you go to the store, right? And you buy stuff. I mean, you don't know where it's been, as my mother used to say. So, maybe disinfect packages and things like that. And then with the restaurant, it's the same question. If you're sitting in a restaurant, can a bunch of droplets get up your nose? Right? That's what you need to be thinking about. And so the social distancing in restaurants is probably important. Some restaurants have hung up like plastic sheets between the tables, or they put perspex dividers and that kind of stuff. And if you're satisfied that the droplets can't get up your nose, then sure, have a meal in a restaurant, but I'm not eating out at the moment. I was invited to go to a Scottish pub in LA a couple of days ago, and I said, no, I don't think so. I don't want to take that personal risk because I'm in a high risk group. I'm of a certain age that if I caught it, I probably wouldn't do very well. So
better to have a dram or two in the comfort of your own home.
Well, exactly. And like most Brits these days, I prefer drinking at home. But, but no question, it's done a job on the restaurant business. And, I went to my cleaners the other day to get some clothes cleaned, and his racks are half empty. Normally they're overflowing. So people's businesses have taken a hit. And actually even hospitals have taken a hit because we all battened down for COVID, and then people who need elective surgery and stuff aren't coming. People aren't taking their kids to get vaccinated against other nasty diseases. Now, I think that is probably a mistake, not to get polio vaccination, not to get diphtheria and all these other things that are really nasty diseases that you don't want your kids to have. So it's very important to get their vaccinations and their immunizations. And of course, local pediatricians know this, and they have figured out how to arrange their offices to minimize the risk of transfer of COVID between patients and from them. So I think it's safe to get those things done. My grandson's been to get his shots, that's for sure.
Makes sense. That's very helpful. And I think the last question on this topic just pertains to exercise. And we know a lot of people are obviously being very conscious of getting their required exercise. And so what do you think of the safety of biking outside or running or hiking or swimming, especially as the good weather from summer comes?
Right. Well, there again, it depends on, can a droplet get up your nose from what you're doing, right? So if you're swimming on your own in your own backyard pool, there's no risk whatsoever, right? If there's 2 or 3 people swimming in the pool, then it depends on who they are and what their exposure history might have been, their contact history might have been, right? If you live in a leafy suburb and you're walking about and you're like 10, 20 feet from anybody you might run into, and you maybe have a conversation across the street, you're not going to catch anything. But if you're going to go to a gym where there's 25, there's 125-year-olds all sweating and spitting and doing what they do, I think the chance of catching something is quite high. It's just this question of how dense are people and how much exhalation is going on. So that brings up the question of choirs and shouting and vigorous debate and things like that. So it's all about spitting, basically. So I'm a great opera buff. I love to go to the opera, and I like to sit in the front because I like to see them spit. Oh, maybe that's not so good idea at the moment, Maybe I should go sit in the balcony instead.
Lots of streaming options right now for the opera as well. So.
Oh, yes. Well, that's right. Glyndebourne is on and all that sort of stuff.
Of course.
Yes, exactly. So, so I'm just think about it. It's not rocket science. How far are you away? Do you think there's a reasonable chance a cloud of droplets can get up your nose?
Thank you for all of that information. I think next we're going to just move on to maybe symptoms and how it impacts different levels of population. And this came from one of our members. Does it impact everyone equally? I keep hearing that my grandson will be safe, but that myself as a senior are more at risk.
Well, statistically, that is true. So I don't know how senior this person is, but if they're over 80 years of age, the severity of the COVID goes way up. There have been centenarians who've survived. I've seen occasional pictures of people who are 103, 107 surviving, but they don't look very well, like they didn't have a very good time of it. So personally, I don't relish the thought of being in an ICU on a ventilator. Mm-hmm. And if you get that far, the mortality rate is about half. Right. So you don't want to get there. No. So if you look at it this way, if you catch it and you die, that's 100% mortality for you, okay? If you are over 80 and you have pre-existing conditions and you catch it, your mortality could be as high as 60, 70%. If you're a younger adult, it's a lot lower. And if you're a kid, it's even lower, but it's still not zero, okay? So I think it's just, you got to realize that not everybody is the same. Men have more morbidity than women. And it depends really on how old you are and how many other diseases you've got. So if you've got hypertension, diabetes, gout, and COPD, and on, each of these risk factors stacks up so that your risk of being very ill and dying gets worse.
So basically, what should I do if I have a fever, if I'm experiencing problems breathing? Should I take myself to the hospital? What should I be worried about? So the usual starting symptoms are feeling as if you have a bad cold or the flu, basically. So it's feeling unwell, start running a temperature, can be quite a high temperature, 102, 103, something like that. Feeling very, very unwell, having to lie down. And then the question was about breathing. So if you're having difficulty breathing, or if somebody notices you look blue, you probably need to go to the hospital. And I would call your doctor or call the local hospital and ask them for advice. If you think it's an emergency, call 911. Don't try and drive to the hospital if you think you're sick. And go and get yourself evaluated. With this disease, people can get much sicker than they think they are. So when we have people adults coming to the hospital, looking quite blue, and yet not being in respiratory distress, so that's a worry. Yeah. And that's what happened with Boris, right? I mean, the chaps at number 10 said, you better go to St. Thomas's Hospital, which is on the other side of Waterloo Bridge, Westminster Bridge. So that's kind of how it works.
I think most people can manage at home, but if you're having severe respiratory issues, you need to be at the hospital, because then you can get oxygen, you can get round-the-clock nursing, and if necessary, you can be ventilated.
Okay. And I think our next question is, how long should you quarantine if you have symptoms? But I think it's really just people, for myself, it's just reminding yourself of a little common sense. And yes, it is a scary time, but really it's just consulting. Does this sound right? You know, consulting your physician, consulting your doctor.
Right. But a good rule of thumb is, if you think you've got COVID or you've been exposed to COVID in a significant way, then you really should quarantine for 2 weeks.
If you have any thoughts that you might have the COVID, you should just quarantine, full stop.
Well, I think that's the wise thing to do.
I think that, well, right now, there are so many testing locations around. Certainly, we're in Northern California in the Bay Area, but I know that in Southern California, there are a lot of testing locations also. Would you also recommend that you can get tested in your car, like drive-through testing locations?
So the thing about testing is that it can rule it in, but it can't positively rule it out. So if you test negative, you don't know that you didn't have it, because the tests are not completely accurate. But if it's less likely to get a false positive.
And doctor, this is a great segue, I think, to kind of immunity and testing. So I want to dissect that statement a little bit more and talk about the practical applications of testing. People know there's an antibody test, and there's the antigen test, and there's false positives and false negatives. And could you help to simplify it all for those listening?
Sure. So the first question is, do you have active virus up your nose? Right. So they stick a swab up your nose, they swab some cells, they take it to the lab, and they do a PCR test, which will amplify the RNA of the virus. And if it comes up positive, then you have viral RNA in your nose. Right. Then there is an antibody test that's been developed, which they take some blood, separate the serum, and test that for antibodies. And if you have antibodies, that means you've been exposed to the virus and you've developed some immunity. So those are the two main types of test.
And in terms of the accuracy, so if I get a positive for either, if I get a negative for either, how certain can I be?
Well, I think if you get a positive for either of those, you can be pretty sure that you've had the virus. If you have a negative, you cannot be completely sure you didn't have the virus, because sometimes the PCR doesn't work or the antibodies don't get detected. So they're not completely foolproof. They're pretty good when they're like 80-90%, but there's still some margin for error.
That makes sense. And so let's assume that one does get a positive, and so we have some confidence that you've had the virus. Can you contract it again at some point in the future?
Well, that's not completely clear. Some people think they've had it twice. One of the things that could happen is that you could have a relapse. If the virus could start multiplying again and make you ill again. It could be just the first infection. Some viruses do that. The CMV virus, for example, does that, can make you sick for a long time. Some people are sick with this COVID syndrome for months. There are people who have a very long sort of relapsing course. And then the question is, are the antibodies that you've made, are they good enough to kill any virus that gets in your system, right? So they have to be neutralizing antibodies, and there'd have to be enough of them. And then the last question is about a vaccine, which is probably you're going to ask me. So people have tried for years to make a vaccine to the common cold. Remember, there used to be a cold testing station in the UK where students could go for the week and be inoculated with the common cold and vaccinated and stuff. And that was a miserable failure. Nobody was ever able to make a successful vaccine to the common cold. However, we do hear that with this virus that there are some vaccines that have been made that appear to stimulate antibody production. Whether they're neutralizing antibodies and whether sufficient to prevent another infection is still an open question, and that's why we need to do phase 2 and phase 3 trials. So right now, all that's been done is a phase 1 safety trial, so the vaccine doesn't kill anybody, which is good news, right? But we don't know whether it's efficacious yet, and that takes time. So we won't have a vaccine for another year or two, probably. And then we've got to make it, which is a huge financial undertaking, and manufacturing facilities had to be built and all the rest of that. So that's why Big Pharma is getting involved, big pharmaceutical companies, because they have the resources to do that. Individual labs do not, and the government is helping.
Makes sense. And so as you mentioned, there is a decent amount of time before we get to a vaccination. And so I know many people are thinking about the interim step, treatment or preventative drugs. And I know we've heard a good amount about hydroxychloroquine and other antimalarials. Can you speak about any of these?
Yeah, well, I was skeptical about hydroxychloroquine. It's been around for a long time. It's quite efficacious as an antimalarial, and it is sometimes used as a last resort for pulmonary interstitial lung disease, but it's not terribly efficacious for that. And it's used for some rheumatological disorders. There again, it's not magical. So I'm not surprised that no one has been able to show that it works. There have been a couple of papers about that retracted recently. Apparently there were some dodgy papers that got published in the New England Journal of the Lancet. That happens, but that's how science works. I mean, science is a stack of hypotheses that are supposed to be disproved. And so that's how science advances. So sometimes stuff gets published, which is dodgy. But then somebody notices, especially if it's published in a journal like that, people will notice that it's dodgy and it'll get refuted. And these papers were retracted. And that is how science is supposed to work.
David, thank you very much. And that in my own, just thinking about what we've been discussing today, has there been any precedent for this before? I mean, what is the end game for the virus? I mean, you've mentioned before, we've had the silent movie before, I believe, when we've spoken. I believe that's in relation to the Spanish flu.
We've seen this movie before, right? We've seen this movie before. And we've seen, in history, we've seen major pandemics. I mean, there was the Black Death in the 1400s, right, which killed half the people. And it turned out the other half had some natural immunity, and the modern population is all bred up from them. So most people have some natural immunity to the Black Death. And then we had the influenza epidemic of 1918, 1919. So in that case, there was lockdown, there was mask wearing, people got tired of it, they took off the masks, they went to the beach, etc., etc. And then there was a massive second wave. And then by the time that flu had burned through the population and killed a lot of people, there was enough herd immunity. In other words, enough people had immunity to that influenza that it couldn't replicate. Because if the viruses can't find fresh meat, they're dead. So I think what's going to happen here is that absent a vaccine, because now we have flu vaccine that works quite well, absent a vaccine, we're going to have to get to herd immunity eventually for this to stop. But we don't really want to have to go through all the sickness and death to get to herd immunity. So it's a little tricky. It's a balance. And we also don't want to be ruined economically. So we need to have some economic activity. So people can't stay on COVID holidays forever. They can't stay on COVID vacation forever. So it's going to have to be a balance. And like I said, if the virus can't find fresh meat and can't jump from one person to another, then it's not a problem. It won't transmit. We hope that with the summer, when we can fry viruses on the sidewalk in San Francisco, in Los Angeles, that we might get a respite because the droplets can't transmit as well. Maybe in San Francisco, where you have foggy air and the droplets can hang about more, maybe you won't get a respite. I don't know. But that's how some viruses, respiratory viruses, are seasonal. They're usually worse in the winter. Flu is like that, for example. So we'll have to see. We don't know. But you know, we can do something about this. We're not helpless. We can do our social distancing so that the viruses can't jump from one person to another. We can wear a mask so we don't sneeze on other people, and if they sneeze, the droplets hopefully get stuck on the mask. We can wash our hands so that we're not taking droplets from our face and our mouth and giving it to somebody else, and they're not giving it to us. So these things actually work. We can clean surfaces in case there's any droplets or snot hanging around on surfaces. And that's what we've got to do.
David, on behalf of the British Benevolent Society, I would like to thank you very much for joining us today, and also for your frank views and advice, and most importantly, what we can all do to try and stay safe. That's I think central to all of this and to all of us as Brits and anybody living out here in the United States and the West Coast. So if you've been listening today, and if you feel concerned or you might have more questions, please don't hesitate to contact us at the British Benevolent Society. You can reach us at www.bbsofca.org. That's our website. We also encourage anyone who would like to get involved with the BBS. We're open to everybody and would welcome you to contact us. As a charity, we really need volunteers right now to help raise awareness and help build our community. You can also really help us by donating money to the British Benevolent Society, and you can do this through joining as a member or just making a donation. Every little bit helps. Your donations will be going directly to helping fellow Brits in need who have fallen upon hard times, particularly now due to this awful virus. Again, please don't hesitate to contact us at www.bbsofca.org. Professor Warburton, once again, I'd like to thank you very much. We really appreciate your time. Arif and Jen, thank you for collating all the information, and I wish everybody the best for the rest of the day and for the summer ahead. Thank you.
Thank you, Gary. Can I just give a quick shout out to the St. Andrews Society of Los Angeles? I'm vice president of that organization, and we're very pleased to help support BBS in its mission to relieve a couple of Scots who got stuck in Los Angeles and needed help. So thank you for that.
No, absolutely, and we welcome your support and look forward to being good friends for the future, the two organisations. And your very generous donation absolutely went to helping two Scots in need. So thank you again for that, David. Absolutely.